we want people to understand that public health will include having legal services, and that there's a public health connection to legal as well. And so Dora Barilla is helping us with that. By the way, for those of you that have seen our podcast, the Joe Speak podcast, is on all of the platforms. It's also on YouTube. We just released a podcast with Dora yesterday, by the way. Okay, so Dora owns a company called HC2 Strategies.
That's it.
Okay, HC2 Strategies, and HC stands for
Healthy Connected Communities.
Healthy Connected Communities. And what's interesting about what Dora does is we all kind of have a moment where, hopefully, where what it is that you've been doing, you've been dedicated to for a long time, the world starts paying attention to. And so now the world is paying attention to public health, but she's been doing that for 30 years. Okay. And so why don't we talk a little bit, first of all, Dora, tell us about your journey to public health and how you got to doing what you normally do now.
Well, thank you, Joe. And it's just a real pleasure to be here. And I'm excited about this journey and really looking at supporting healthy communities and how can we do that in a way that probably we've never done before. So I think a real opportunity. But thank you, Joe, for the question. I've always wanted to help people and to really look at, how do we keep people healthy? And originally it was like, okay, you eat right and exercise, right? That's being healthy. Yeah, not to dismiss that, because we all need to exercise and eat healthy, but it really is just a much more holistic way of really looking at what creates health. And so I really got my bachelor's of science in sports medicine, and realized, in my first, my early 20s, that it wasn't about eating right and exercising. I was working for a managed care organization, so I was looking at people that were utilizing health services quite a bit. And it really occurred to me very early on in my career, like the big light bulb went on, that it's really about social connections, what we're calling either social determinants of health or population health or whatever it is. It's about what is it in a community that really, what makes you healthy? And it really is those social connections, not only your behaviors, but what are the resources offered to you, what education, and so that was really my journey into looking at a much more holistic way and really looking at how we can start to build trust. I often tease that, my kids used to say, well, what do you do? What do you do? Because, it's like, I'm a doctor of public health, and what does that mean? And people finally know. And I'll talk a little bit about, my journey in this last year and a half with COVID that has really kind of shifted the way I'm thinking about how I'm using my skills that God gave me.
So what should we be thinking about when we hear terms like community health and well-being and whole health and those types of things? Let's set some terms so people really ought to know that there's something behind these terms, or things we should be looking for, things that we should be thinking about when we're talking about these terms in this space.
Right. Well, in healthcare, we call it whole person care, or, just really looking at a holistic thing. But if you think about it, what makes you, let's go to you as an individual in your family, in your community. What makes you whole? What makes you healthy? And how can we, rather than a profession telling you what that is, that you're really thinking about what is it that is going to give you agency in life? What is it that's going to make you want to get up in the morning? What are those things? So really and it starts obviously with eating and having safety and having a home, right? But then also having a safe neighborhood. So there's so many elements that are really involved in looking at, kind of that whole person. And so, but really not having us define it, but individuals and communities really helping define it. And that's why I think, just thinking about what are your needs that need to be met in order for you to feel safe and for you to feel healthy.
What are some of the things, now we're getting into our pandemic public service announcement section. Let's talk about some of the things that you would want people to see that connect the dots with what you do every day, that really should be in full view with the pandemic in general, the uptick that we're dealing with in particular, and what we ought to be thinking about right now related to that. Let's give folks the playing field on that.
Yeah, and I want to just preface this with a little story I actually told Joe this morning. I'm a doctor of public health. And I think the most recent data I have is in February of 2021, we had 180 state and local public health officials either resign, be threatened out of office, or leave office for some reason. That is the nation's mass exodus of public health professionals in our nation's history. Okay, so just let that resonate for a moment. And so as you think about what are, really, and I know I'm one of the public health professionals, but really, I mean, our job is to protect the public's health. And it has been politicized. There's been a lack of trust, and Joe talked about that. People really have a lack of trust. And so public health professionals have been doing the best that they can with getting information that we know. And the reality is there was a lot that we didn't know. And so I just preface that by asking us to come into a common space of what we know, and that we all have a common that we want to protect ourselves, protect our families, and protect our communities. And so I want to start with that because I was actually working for the third largest health system in the country when the pandemic broke. One of the first cases was in our hospital. And I happened to be laid over in an airport in Seattle when the outbreaks were really happening. And so I sat there for 16 hours watching news, watching data. And as as it unfolded over the year, we got the best information that we could. And, there was, just on top of just historical mistrust, that information was trying to get out as quickly as we could. So I just, as we think about this, we really need to think about where is the information and the data coming from? And I always like to say, in God we trust, all others bring data.
That's right.
And so as a public health professional, always looking at what is the data telling us? Not what are the stories that you're hearing? What is the data? So from early on, actually one of our local companies in the Inland Empire, Esri, had the backbone for the Johns Hopkins data in terms of what's been happening. And we know that we had a mass pandemic, not only here in the US, but in the world. The world has changed. We know that, like Joe mentioned, what COVID exposed to us is the disparities in our country that have been there for a long time, but they were magnified and amplified due to COVID. Some people were disproportionately impacted because of COVID. We know that people died. In our country alone, 602,000 people died of COVID. Let that resonate. We know that in the midst of the pandemic in December and January, that over 3,000 people were dying every day of COVID. It has gone down to about 300. Okay, that is on the uptick. 97% of those deaths could be prevented now. We do know that we have an emergency authorized vaccine. We do know that it is safe. We do know that there is some mistrust of the vaccine. I was one of the first to get it. We know that it is safe. If you think about the vaccines, when we were kids, they did not have the scrutiny. The world looked at the vaccines. I'm here as a public health professional begging you, go out and get your vaccine. They're available now. When they first came out, it was hard to get them. Now they are available. We know that the vaccines are decreasing the incidence of COVID. We also know that the uptake that's happening right now is in the unvaccinated population. And what happens is, yes, there are cases where there are breakthrough cases where people that have been vaccinated are getting COVID, but that's because the virus is allowed to mutate. We need to address this. This is real. People are dying. And I say that from, really looking at being in the health system where we had to order refrigerators to hold the dead bodies. Right? It was one of the most devastating, traumatic experiences. And I understand that, people have the mistrust. But if you look at, really the public health conversation, how can we protect ourselves? Also, there's things that we do know. We know that social distancing, we know that that masking up makes a difference. If you look at the incidence rate from when, in California, I think it was June 15th, that they, started lightening up on the mask mandates, the incidence started going up. The Delta variant is real. If you look at, where do you get information? I go to every day, I'm on the Johns Hopkins looking at the data, not only in the US, but in the, all the other countries. I sit on the board for Medical Teams International. We are having little countries throughout the world that are being decimated by COVID. And we have the resource, the education, and the knowledge to address this as a community. And so this is what we know. Some basic public health measures decrease COVID. We know that masking, social distancing, washing your hands, using good measures are making a difference.
Excellent. Let's talk about, and guys, at the risk of taking a chance, that's where we stand on the vaccination. You ought to be getting vaccinated. Did I say before? 99% of the people that are dying did not get the vaccination, okay? Governor of Alabama was talking about people getting vaccinated yesterday. Alabama is 33% vaccinated, and they are suffering a consequence because of it, okay? The worst thing that could have happened is this thing got politicized. It's the worst thing that could have happened. But if you weren't sure whether or not the vaccination works, you should know now that it does work, yes. All right? So let's talk a little bit about health and equity, equity in the well-being framework. Talk about the drivers of health, if you will, the health, well-being, and equity, and how what you're trying to do connects to equity, and kind of where we're going, and then we'll sew it up by connecting it to legal being a part of that whole person health as well.
Yeah, well, you think about what are the drivers of health. I mean, they're just the basic senses of safety, food, housing are pretty commonly known. But also, what about that sense of kind of that civic muscle, that your ability to have meaningful work, the ability to be able to make a living, the ability to be able to achieve an education. Those are all the things that are clearly drivers of health. If you're not working and you don't have employment, that's going to be a real impact on your health. And I don't mean to dismiss, having access to health care and all of those other things, but we clearly know that there are other drivers of health. We know that, in our country that we don't have equal distribution of health. That's very well known. And so as we begin to talk about equity, it's not only about having access to health care, and I don't mean to minimize that, but what other resources do you have access to that enable you to really begin to look at making a difference? Kim, I'm not doing a commercial either, but you can't. What did you say, Joe? You can't buy you can't sell what you don't buy. So my husband and I actually, when I was asked to work with McCune Wright and Pro Se Legal, went through Pro Se Legal, and it's just thought we'd clear up some loose ends, and so just had some deed and just a few issues, and she'd asked some questions, and I saw too many nurses making wills in bathrooms during the COVID. Oh, yeah. And just really making sure that we had all of our ducks in a row. And spent a couple hours with Kim, and we ended up going through our shed, and there were some old legal documents that we had, and he goes, well, we need to talk to Kim. But the point is that, having access to those services, to that basic information, not everybody has that. And so, you don't even know what you don't know. And there's so much about just in terms of the drivers of health, in terms of keeping, they always say the rich get richer. Well, it's because they had information in terms of how to retain their assets.
That's right.
And as a community, in terms of looking at public health, having your assets, your home, you worked hard for that your whole life. And to see that just decimated because you didn't have some basic protections that we all should have known, those are real drivers of health.
Yeah, that's right. So tell us, I'm excited about it. I know the answer to this question. I love pitching softballs. Tell them this, tell them this. Tell us what you're going to be doing as part of the McCune Wright team. And this is where we're flipping it. Nobody's doing this. Tell us how, we got together. You got together with Rich, our managing partner. Shout out to Rich McCune, our managing partner, who's putting folks in place and letting them do what they do. Talk about how you're bringing what you do to MWA to move us forward, basically with a public health view that includes legal as part of whole person health.
Yeah, so how exciting to be able to speak about public health from where I'm sitting today. I mean, that's pretty exciting.
Nuts, yeah.
And so to think about that in all honesty, I really did some vetting when I was asked, and I, just looked at the legal firm and looked at what they were trying to do, and I'm sold. It is really looking about how do we create health in individuals and in communities for everyone, not just those that can afford a lawyer and that can easily access, the network, their network of influencers and people that, often drive decisions. But we can really begin to look at the whole person, not only in terms of, I can talk about COVID and share why you should get a vaccine and still wear a mask and wash your hands. And Joe can sit right next to me and talk about some of the legal implications of COVID and what are, some of the employment issues, because that's the whole picture. In the last 18 months, we really got to see that what COVID did and how it impacted like our healthcare system, that we weren't prepared. We weren't ready to address all of the issues that really impacted with a pandemic impacts. With a more inclusive looking at what we call the vital conditions of health in a community, we can really impact health. Not looking at it from a deficit model of always trying to react to disease and react to what's happening in our community, but we can actually sit back and say, what creates life? And how can we start promoting that and working on that in our communities rather than a deficit model?
Fantastic. Any questions on what we're saying is that basically if the law, I deal with equity issues. I look for equity issues. I look for equity Goliaths to slay, okay? Except I'm a David with resources, okay? We're looking for equity issues. Health is a cornerstone equity issue. And so, you remember, for those of us that paid attention at math, I didn't after 10th grade, but that's another story. I can tell you everything I've been delivered from. If A equals B, B equals C, then A equals C. Same thing. If law connects to equity and equity connects to health, then law actually connects to health, okay? Because among other things, we want folks to be able to get around the corner and deal with these issues before they become issues. You just heard Kimberly say that something that's non-probatable cannot be touched. Just in case we didn't button that up, I think we did, but in case we didn't button that up, the whole thing about probate, the whole thing about having something in the trust is it keeps it out of probate. That's the whole point. Keeps it out of probate. Your will says this is where I want it to go. Your trust says here's where it is. Your trustee and your administrator make sure that it happens, and you stay out of court and never the twain shall meet. That's the whole point. Imagine dealing with those issues when folks die. You're already dealing with the trauma of people dying. So just deal with things ahead of time to the extent that one can. It has a potential to affect or simplify your financial planning. All of the things that it is that we're doing but we want legal to be part of your whole person health. That's where we're going, okay? Yeah?
And just to piggyback off of what Dora said is, on just talking about public health, with domestic violence and divorces, I mean, you're dealing with some PTSD, you're dealing with depression. People, we had a gentleman that lost his business during COVID. He actually, from the stress, developed Parkinson's disease. He came in just so that we could dissolve his LLC and send one simple paper into the Secretary of State. He passed away.
Right.
Because of the stress.
Yeah.
And it makes me think, had he maybe reached out to somebody when that issue started, then he could have, adequate health resources to that. Maybe they could have helped him with, cope with that stress.
Right.
And I so appreciate the fact that health is so pertinent with legal, again, because of the PTSD stuff, because of depression, because of anger issues, and then that filters out and still affects society. People lose their homes. I mean, I'm sure the public defender, people just, stuff happens. People snap just because of stress.
Yep, absolutely. And being able to provide those supportive services, around legal is really exciting. So I'm already cloning and scaling Kimberly.
That's where we're going. Any other questions?
Still a 3-year rule in contemplation of, so when people go, well, I'm not old enough to need a living trust, but if you do it, and then there used to be a 3-year rule that if you didn't do it by then they could revoke it.
Kim, what would you say about that? That doesn't exist, does it? It doesn't ring a bell with me. I've been doing this for a minute. It doesn't ring a bell with me. So, no, I think that I don't think that's an issue.
Okay.
Who's, yes, ma'am, go ahead.
As a retired public health educator, I would like for us to take a look at the social determinants of health really start with public policy.
Yes,
And we have to be more engaged in that process so that the things in our community that need to get attention,
Right.
such as part of this COVID situation was a tremendous upkick in mental health.
Yeah, that's right.
And we really need to be able to figure out how to address the policy. For example, Public Health Department just changed its whole org chart. Public health is now under Public Works. You know what Public Works does?
Really?
Cut the lawnmower and that kind of
Wow.
stuff.
Wow.
So when you see those kinds of changes and shifts, you know that it's not in our best interest and that we need to engage so that we can get the most out of those departments that need to be able to happen.
That's one of the things that's nice about what I do is part of my job is going to be advocacy. And so we can weigh in on issues and things that are happening and how they affect the conditions of the people that we serve. And that would be very much in line with that.
Yeah, thank you for highlighting that, because
Yeah.
that's so key. And we know that historically, we've had, just an underinvestment, and it can't happen anymore. And
Right.
just to be partnered with legal is really exciting, to be able to highlight those, elevate those, and challenge some of those.
Right. Go ahead, Linda.
Couple of questions, so that I just need to make this public. Thank you, Beverly, for that, because I can echo that. But what I really want to say first is that this room should be filled,
Yeah.
number one.
Right, sure.
People go to the trust because it is a trusted, go to the church because it's trusted. So I've been funded by the state of California. I just don't do the Inland Empire any longer. And I'm finding out when I'm dealing with Los Angeles, it's totally different from what you are doing now. The process in getting the funds down to the city and county of San Bernardino is atrocious. To get the services out because it's atrocious. The next thing is that we have partnered, we're on our 8th church, and so I will hire liaisons from the church. I'm just going to say publicly, the next one you all do, I definitely want to be a part of that because the church
Right.
is what needs or who needs this information more than ever.
Right.
And that is something we must do a much better job.
Yeah.
This is such vital information
Right.
that we all need desperately.
Yeah.
So we need to redo this all over again.
Well, it'll also be available on demand
And
as
let me
well. That's why
just-
we're recording it. Yeah.
And let me say this to you as well. Just yesterday, $20 million is out there.
Yeah.
So I'm here on a fact-finding mission
Sure.
to see what attorneys I can use
Sure.
in my network. They're
Right.
giving out to 10 agencies. And so it's important because you have all the components
Right.
of everything, all the resources
Right.
of everything that I believe that HUD is telling me, who sent it to me, Linda, we need your help. And I'm seeing what I'm seeing, but we as the community, we got to do a much better
Right.
job in
Right.
getting this information out
Oh,
to
yeah.
make a difference. So I definitely want to make sure I talk to you out.
Well, the information is available, and that's what we want people to know, for sure.
Yeah, and this is our first, I mean, one of our first clinics. I know Joe's been doing them a couple, but,
Right.
you know, that's the whole point. Amen to your statement, because we need to do this as community. We can't do
Right.
this alone. We can't do this in silos. That's why, you know, being a public health officer, working with a law firm is really exciting, because let's not go back to normal.
Right.
Let's go back to better, and let's go back
Yeah.
together.
If COVID didn't change you, you weren't paying attention,
Yeah.
spiritually and otherwise, really. Was there a question here?
I didn't have a question, I just wanted to say thank you for the input.
Oh, you got it.
And health, I want to piggyback on what Kimberly said. Most of my patients, it has been COVID-related stress, strokes, early Alzheimer's, health is very important, and it's the number one thing before anything. If you don't have your health, you don't have anything.
That's right. Last question here.
Yes. I have two things to talk about, and it's very quick. And it's about the protection that the medical personnel got in case of, like in ICU. I was with malpractice because they neglect me. And then I had an infiltration in my arm, and I almost lose my arm. And then you see this? I didn't come with this.
Wow.
And then I'm a realtor, and then I wasn't able to come back to my work for 4 months being in the hospital.
Oh, wow.
And then, but the question is this, that I see that most of the nurses that were assisting me there, when I talk to them, they graduate as a nurses in Philippines. And then they come here, they just only do the test that is to upgrade. They don't go to over other things, but they don't have the experience. And then I see that I go to my regular group of medical doctor, and never I see a doctor. I always see a nurse practitioner. And then what happened? I'm very sorry for all these doctors that spend 15, 20 years of their life going to school, and they have big loans, student loans, and they are not hired because they are going with the cheap. This is one of the things. And the other thing is there is something, that, how can I tell you this? My doctor, I had one attorney that he got tumors, and they said they fathered and 2 kids. And then they are looking at my case, but they said there was a law in California that even but if it is COVID-related or something, they cannot sue the medical or the hospital. And then how real is this? Because this was that, for what they were telling me, I was in coma. And then they were telling me that the nurse at this time didn't want to report it, that I had the infiltration. She waited for the next and the next. And they let me like to be a balloon with all the antibiotic that I had.
Right.
And then now is the question, my attorney is telling me, I don't know if I'm going to take this case.
Right.
After 8,500 pages that my medical records sent from the hospital to them. And then it's,
Well, I can't weigh in on your legal situation, but you have to remember that we're related to COVID issues. There's not a lot of precedent. In other words, it's not necessarily clear that a hospital or whoever else would be liable based on something that they did not know. So timing and things like that is going to figure in. We also don't have a playing field for it. We haven't dealt with it before. And then the final part of medical negligence that's difficult is that under the state law, that your damages are limited. And so there's an act called MICRA, going back to 1978, is that on the intangible or emotional distress related damages, your maximum recovery is $250,000. The maximum recovery or percentage from the attorney is relatively low. And so unless you've got huge damages, attorney might be less likely to take the case, but because it will be fought very vigorously on the other end, and in a contingency fee business, it may not make cost sense for them to do. I can't weigh on your case in particular, but medical negligence cases are difficult to begin with, and they're probably made more difficult by the fact that we're in a new area because they don't know how they're going to come out. Because how many people, can you imagine how many people could actually sue for medical negligence related to COVID? I don't know that there's a specific law that says you can't do it. I don't really know that, but it would be a difficult case, and I think that that's what your attorney is telling you, that it's difficult. Let's get this question real fast, and then I'm going to bring Derek up. Go ahead.
My concern is that the current administration said Tuesdays ago that they want to mandate people, and my radio station, 107.9, they're going to knock on your door to see if you've been vaccinated. Now, we have a member of our church, and some of y'all know who she is. She has a lung condition, and she is not going to get the vaccine. Okay, but she's talking about, okay, here's my point. Has the health department got those orders down that you're going to knock on our door? Come into the neighborhood, because that's what they said.
I'm not in that space.
Yeah, no, I mean, and again, just making sure that we're, checking our information, because there's a lot of fear out there.
Oh, no.
Yeah.
The current administration, the president said that they're gonna implement this so that the community, supposedly helping the community, so everybody's vaccinated. Everybody don't want to be vaccinated.
Yeah.
That's my point.
And I think, there's going to be, this is unprecedented times, unprecedented times. I think what the move right now is, let's get as many people vaccinated as we can. Because the reality is, and, maybe there's some, people are afraid, of the hospitals were filled, and it was a horrible situation. And so I think it's really a matter and an effort to get as many people vaccinated as we can.
I really got that. I guess the reason I brought it up is because you're going to have some people say no. Now what's going to happen?
Right, but if they're saying no because they don't feel like it, they're wrong.
Okay.
If they're saying no because they have a legitimate health concern related to it, that's a separate question entirely. But how you deal with it, we don't get to look back 103 years ago. Last time we dealt with a pandemic, here's what we had, here's the access we had, here's the things that we can do, and here's how we'll deal with it. We're still doing that as we go. We don't have that. We don't have that muscle memory and that institutional knowledge. So, yeah, should there be a discussion related to people that are having health issues, and those health issues might make it more of a risk for them, a legitimate risk, to have the vaccination? Yes. But does that also mean that they should be going and getting on planes? I had somebody come to me and say, I don't want to get the vaccination. I want you to do a presentation and help me understand whether or not they can keep me from doing all the things that I want to do. That put other people in jeopardy because they don't want to do the vaccination. I have no sympathy for that position, right? But there are people in the category that you're talking about, and I think there has to be an acknowledgement with that. So, okay, good stuff. Thank you for that.
Thank you.
All right, guys. Thank Dora. Thank you very much, Dora.